July is National Minority Mental Health Awareness Month, a time to raise awareness about mental health issues facing underrepresented groups, including the Black community. We're joined live by Chidi Njoku, Director of Psychiatry and Addiction Medicine at Kaiser Permanente South Bay Medical Center. Thank you so much for being here. Chidi, I think this is such an important conversation, and I think back to when we were in COVID and George Floyd happened. There was a lot of talk about the need for mental health care when it came to people of color, because there are unique challenges there. Can you take us through why that conversation has slowed down and why we need to start talking about it again?
Well, first of all, thank you for the time. Appreciate it. I would say, time, distance from the situation. Naturally, there's a numbing effect there. But irregardless of the numbing effect, the reality is that within the American society, the challenges that people of color that struggled with over the years are still there, very pronounced in a very pronounced way. We see instances of discrimination, racial profiling, things of that nature, and what it causes is an acute stress reaction that many people of color struggle with on a day in, day out basis. It leads to instances of hypervigilance. It leads to higher rates of PTSD, higher rates of depression, higher rates of anxiety, all of which have a profound effect on the way that people show up in their everyday lives. And so it's critical that we continue the conversation related to these matters because of the profound effect that it has both on individuals as well as the families and communities that they reside in.
Well, I'd love for you to talk more about the fact that there is such a correlation between these acute stressors you're talking about and real physical health problems. I mean, these aren't things that you can just necessarily deal with in a quick 30-minute session with a therapist. I mean, these are real issues for people of color.
Correct, because when you think about a stress reaction or even a more chronic stress reaction such as PTSD or so on and so forth, what we know is that leads to higher rates of cortisol in the body being carried for prolonged periods of time. What does that spill over into? That spills over into things like higher rates of hypertension. It leads to weight gain, diabetes, so on and so forth. And then how do people cope with those things? Well, we know that people start eating poorly and they engage in other unhealthy behaviors that impact their everyday lives and then spills over into things like higher rates of heart attacks, higher rates of stroke, all of which, like I said earlier, affect the individual as well as the families and communities that they are within.
Yeah, I mean, I think that's where, I do love the term mental health is health because it does affect your overall being. Can you talk a little bit about how this traumatic stress can manifest in individuals who have experienced racially charged discrimination or harassment?
Sure. So in addition to the physical health symptoms that I was just talking about, we also see breakdowns in people's ability to show up in their everyday relationships. We see challenges with people being able to show up and function in their everyday responsibilities, such as how they show up in the workspaces, how they show up with their families, or inability to do so. And then that trickles over into higher rates of loneliness, which spills over to higher rates of depression, anxiety. We also see that family units start to break down because of the fact that people can't show up for their families in a way that is beneficial. And so what we're striving for is a space where people can get those challenges, those needs addressed in a supportive and healthy way, so that we can see a more healthy family unit. We can see greater, healthier community. What's the word I'm looking for?
Engagement.
Engagement. There you go. Thank you.
Yeah, no problem. I'm running out of time, but I do really quickly, what are resources for people? Because, I'm someone, I feel very privileged. I'm able to take care of my mental health, but a lot of people don't have access to mental health care or a therapist. It can be very, very expensive. What steps are being taken to address this issue?
Well, I know that there are tons of resources in the community that are popping up, trying to make mental health more affordable. I know that within my organization, Kaiser Permanente, there's been a huge investment over the last several years in terms of expanding the network of clinicians available to individuals looking to get support. In addition to making a broader net of resources available, investing in in resources that are more culturally sensitive, acknowledging the unique experiences that people of color walk through the doors with. So that when people come in, that they're not just getting treated for depression or anxiety, so to speak, but their whole life experience is getting addressed and supported in a way that's far more inclusive. And so as we continue to trumpet the need for more mental health services, there's also a concurrent conversation going about the need for resources that are culturally sensitive, that acknowledge the whole person experience, and the fact that all of that spills into how they're showing up in their in the office when they come in for treatment.
Inclusive. I love that word. Chidi, thank you so much for being with us. We really appreciate it.
Thank you.